welcome everybody to my presentation. Today I will be talking about my internship and the shadowing and placement that I did over the course of the summer. So we'll jump right into it. So first is the table of contents. So this is just going to be what I'm going to be talking about today throughout this whole presentation. So I'll give you a background of what the internship is and sort of how it's structured. And I have the introduction to the internship, so sort of how I was able to get the internship, where I did it, and all the other information that's sort of relevant to that. Then the overview of the internship. So they'll be explaining what I did throughout the time there, sort of what sort of roles and sort of responsibilities I had while I was doing the internship, and information learned. So this is sort of the lessons that I learned over the time while I was shadowing the professionals. Challenges was the different sort of aspects that I had to overcome throughout the entire process. So what adversity did I face throughout it, and sort of anything I would like to change. And then conclusion is just the last final words at the end of the presentation. So the background. So I interned at Salina Ortho. They are an outpatient facility in Salina, Kansas. They have a joint system where they have orthopedic surgeons and physical therapists working in the same building. So a client will come in, see the surgeon, and then get referred on to the physical therapist there, and is able to have that communication between the therapist and the surgeon in the same place. I was able to obtain this placement through my professor and advisor, Brian Minnick. He definitely helped me out and was able to put my foot in the door to get this placement. And then for the forms to apply for such of an internship placement, there's a guidelines packet that my advisor, a site supervisor, and the provost of Kansas Wesleyan had to all sign and agree to. And then once all that was done and everything was above board, I was able to continue into the actual internship shadowing hours. So an introduction of it. So throughout the entire internship, my specific topic of study was physical therapy, or physiotherapy as it's known in Australia. So throughout it, I was able to make sort of some comparisons between an Australian dynamic of physiotherapy from my own personal experience and the American physical therapy dynamic, and how they sort of differ between the two. So Australian physiotherapy is definitely more of a one-on-one in a consult room with a physiotherapist, and they tend to do a lot of manual therapy and sort of release techniques, and then at-home exercises. Whereas in America, a physical therapist will tend to go through exercises with the client, and if they need any manual therapy, they'll do that as well. And it's usually in a big training room. And they do have consult rooms, but that's mainly for sort of more privacy when certain areas of the body have to be shown in order to give some treatments. I was able to compare the differences between Salina Ortho and the Kansas Wesleyan athletic training room. So at Kansas Wesleyan, a lot of the student athletes that come in, they have a decent amount of knowledge on what's going on, as a lot of them are pre-physical therapy and athletic training students. So a lot of the athletic trainers trust students to be able to have more autonomy with their own rehab. Also, they're student athletes, so they understand that in order to be able to get back and play, they need to adhere to the rehabilitation program and continue to sort of improve and progress throughout it. For this entire thing, I was able to compare it to those two together. And Salina Ortho, the physical therapist, is with the client every session and sort of holding them accountable and motivating through every step of the way. The client has some autonomy, but not as much as what you would have at Kansas Wesleyan. I was also very excited to do this placement, as halfway through the spring semester I had no idea where I was going to be able to intern, if I was going to get any placement hours anywhere. But after I sat down with Brian Minnick, he was able to stick his neck out for me and help me secure this placement here at Salina Ortho. So I'm very grateful, and I was very excited. I also hadn't had any formal experiential learning like this before, so that was another thing I was very excited to do. So an overview of this internship. I did 50 hours, so that's 1 credit hour at Salina Ortho. I did that in about a week. That was just because I was there from when they opened to when they stopped having clients in throughout the day. So I was able to do that relatively quickly and efficiently. Throughout my time there, I didn't just stay with one physical therapist, and the reason why I did that is I wanted to be able to see different dynamics and methodologies from different therapists and how they interact with clients, how they structure a program, how they're thinking about progressing through a program or a session. And I wouldn't have gotten that if I just followed the one person. I would get what theirs was and not everybody else's. And the whole point of it is to be able to learn and formulate your own sort of attitude and identity towards this sort of profession. So my responsibilities while I was there is, well, first of all, was assistance. So if the physical therapist needed any tools or equipment or any space, I was the one who was going there and making sure they had the equipment needed. So if they were doing an activity with a client, I would then grab the next equipment that they needed, so that way they could just continuously go through and they weren't held up by anything. I also helped with making space. So if they were going to move to another place, I would help like clean it up, make sure there was enough space and it was safe for them to do it. If the client needed any water, I was the water boy if I needed to. Another big part of this entire thing was observation. So I had to sit there or stand there and observe everything that was happening. And if I saw anything that was notable, I would pull out my notes app and I would type it down at that time. So that way I could go back later and refer to it. And if I needed to further get further understanding of it, I would be able to research it and then be able to come back in the next day prepared to be able to continue on that. Questions. Questions is a very crucial role to any internship placement that you do. It's not about just asking as many questions as possible, it's about asking as many good questions. So asking why they're doing something, what's the goal of this treatment, what the outcomes are they expecting, how would they tailor it to this client versus this client. Sort of being able to ask sort of critical thinking questions, so that way like you're showing that you're engaging and that you're trying to expand your own knowledge. Hygiene and sanitation. This is a very big part of any clinical setting, especially after COVID-19. We're all very, very stringent on bacteria and viruses and and we know how quickly it can spread. So after every client, everything is sanitized, wiped down. Any towels or pillowcases or equipment that was used is sanitized. Towels and pillowcases are rotated, so we'll take out the towels that we used, put them in the laundry, swap out the pillowcases, put them in the laundry again, and then do a big laundry load at the end of the night, and then the next day we'd fold it and be able to distribute back out to the training room. And then lastly was make client comfortability. So this was a big sort of initial step that I had to sort of learn, was as a client, if you just have a 20-something student just sitting there and just staring at you and not saying a word, it's going to be very awkward and very uncomfortable for them. So I had to ensure that not only were they comfortable, that the clinician was comfortable and that I was comfortable in that setting. So I started off with some surface level questions, sort of introduce myself and sort of ask some questions like, how are you, how's your day going, how's your injury going, how's everything progressing. And then as I built that relationship, I was able to continue and make a conversation happen and ask them more in-depth questions about if they knew about the injury or procedure they had done, if they had any different feelings, the types of pain that they were feeling and everything like that. So it's just any information they were comfortable giving me, just so I could make notes and sort of understand like why the clinician was doing certain things. This is a major factor in any rehabilitation program, not just for someone interning, but as a clinician, is the whole part of a client coming in to your practice and getting treatment with you is that they're comfortable to do that. They trust you and they want to be there. If they're uncomfortable and they don't want to be there, they're not really going to put the effort in that they need in order to progress and rehabilitate properly. Then lastly was information gathering. So throughout the entire process of the internship, I would just ask questions to any of the physical therapists. I would try and make it obviously a critical thinking question if I could, and they would answer me to the best of their ability. If they couldn't, they would say, hey, I don't know that yet, I don't know that right now, let me go check something and then I'll give you the right answer because I don't want to mislead you. And they would go there, and for me personally, this is what I experienced, is they'd go and find something, If they could explain it, they would. If they couldn't, then they would give me a source to be able to go and look it up myself. So the lessons I learned, so the information that I learned throughout the internship was the clinician and client relationship, and this is a very major key in having a client adhere to a program and progress successfully through a program. You're building a trust, you're building a relationship with them. You're not just treating an injury, you're treating a person, and you should treat it as such. It's a holistic approach that has been taken on board a lot more nowadays after psychologically understanding how rehabilitation works and how a client's mental state affects their adherence to a program. Rehab program design. So this part I took it upon myself as well, like with asking questions. The physical therapist would have the exercise program laid out, and they would have it so that way you could see what they did on day 1 all the way up to day 8 or 9 or 10 or whatever day it was that they were up to. The clinician would write how many reps, what weight they did, anything that the client wasn't able to do, anything that sort of increased pain, or they could have was like, no, that hurts too much, I can't do that, or they're like, that's way too easy, like I'm ready to move on to something else. If they wanted to add any new exercises in, they could do that as well. And the reason why they did it this way is that any physical therapist could pick up the client's program and run the program that day. So if that clinician wasn't in, another one could step in. This was very helpful for me to understand how, as a business, you can sort of structure it, but also seeing how they progressed the client through the entire program, how they started off with a couple exercises and then increased the amount of exercises and the intensity. So increasing volume and intensity and sort of staying in that fit principle when it comes to progression of a program. Pain modulation. So throughout my time there, we had a lot of total knee and total hip reconstructions. So those clients would get electrical stimulation at the end. And as the tissue is very sore and tender, it can be painful for them. So use of an ice pack to help relieve some of that pain was used. Just sort of understanding that, yeah, you may be giving someone a treatment that you're like, this is going to help their muscle activate and the muscle regain its neuromuscular control. You have to also understand pain and how that affects the client wanting to do it. Was also if they were prescribed any medication, asking them if they're still taking them, if they're like easing off of it, if they're at the stage where they shouldn't need it, or if they are at the stage where they should need it and they are still taking it, sort of having that conversation with them and sort of promoting them to sort of ease off of it and sort of not really be dependent on it anymore. Training room hygiene, this is, as I touched earlier, is just sort of how like stringent and what it was to keep everything clean, keep everything hygiene, sanitized. Was very important. So wiping down tables, equipment, changing over everything. We'd have cleaners come in overnight and make sure the room was sanitized and clean, so that way you weren't bringing any new bacteria or obviously spreading COVID-19. Professional behavior. So this is one that I kind of didn't fully understand, just from my experience as a client in my own physiotherapist clinic. Seeing how the therapists interacted with each other, interacted with clients, interacted with us interns was definitely eye-opening, and so seeing like they're a team of people. They're not individuals that are dealing with one client, like their own clients. They all come in and they all like come together and help each other when they need it. And also sort of their professional attire. So they're all, clean and professional looking, so that way, you're presenting a quality business and a quality treatment to a client. Then also on Fridays was a jeans day, and that I felt that was very good in sort of showing that they're not just robots, they're actual people as well. So they're able to have fun, able to work together, but still be professional about it. Continuing education. So all of the therapists there, every year or 2 years, they will attend a seminar or some online course in order to make sure that they're staying up to date with the newest and best research-based treatments available. This was something that was very important that they were making sure we all knew. The physical therapist assistant there, during her downtime, when she didn't have clients coming in, she would sit there and she would do online classes, and she would annotate and summarize what she had learnt, so that way she could apply it to any new clients that came in that had those issues. And she's like, well, now I've learnt this, I can continue with that, and I can keep expanding my vocabulary. That way I can treat more people. Documentation. So as I said, with the exercise program, they would annotate and note anything that they saw or anything new that they wanted to add or anything like that. At the end of each session, they would go to their client's personal file and they would dictate what they did that day. If they had taken measurements of any flexion or extension with a goniometer, they would note that down, so that way any physical therapist would know, okay, this is what you were at last time, this is what we're trying to get to here at this time. The orthopedic surgeon could also look at that and sort of see like, okay, this is where the client is. They can monitor it, and if they need it, if they see like, okay, they're not progressing how I expected it, I would like to see it as well. So everyone is communicating, everything is well documented. So challenges. For me, the initial introduction to all the therapists and the clients was definitely a hurdle that I had to jump at the start. I'm not exactly a very extroverted person. It takes me a little while to come out of my shell. Unless I know people and I know like people there, then I'm able to relax. So at the beginning, I had to sort of figure out a sort of mental way to overcome that, and step out of my shell and be able to introduce myself to people and create like a little speech or something like that, a prompt to be able to open up a conversation with the client. Like, hello, my name is Fraser, I'm an intern, are you okay with me shadowing? If they were all on board for it, then we'd continue on. If they weren't, then I'd be more than happy to just step aside, let them go about their session. Finding a routine. So as I sort of mentioned this just then, was finding a routine at the beginning is a bit difficult, but once you get it, you're able to relax and able to flow through the day and able to keep yourself busy throughout the day and not just sitting there and doing nothing and kind of just being a fly on the wall. So sort of understanding, okay, when this happens, okay, I need to do that. So like if we had a client that was on electrical stimulation, once it was done, I knew that I'd then have to go in, take the ice pack off, sanitize it, take the pads off, put them on their own little plastic card. Every client had their own pair of electrical stimulation pads. So that was another way we were managing hygiene and sanitation. If like a client was done, I'd know that I had to go in, sanitize the table. If anything that needed to be done, I would kind of figure out what I needed to do in order to be helpful, and I wasn't just a burden, just someone sitting there or standing there and doing nothing. Because you're not going to get anything out of that if you don't engage in what you're doing. And then obviously the biggest hurdle is the COVID-19 lockdowns. So I finished up at Solana Ortho and I came back home to Australia, and then in a week Victoria went into lockdown. We had limits on how far we could leave our house, so there was a lot of clinics that I couldn't attend. Also, a lot of clinics weren't taking students at that time just because of contact tracing and everything like that. They didn't want to risk, making their patients uncomfortable, making themselves uncomfortable, and sort of increasing that risk of being shut down if there was a positive case at that time. So that's a little challenge that I had to do. So I was able to sort of combat that after talking to Professor Minnick and the provost, that I was able to do some video summaries instead. So that's what I did in the meantime. So in conclusion, what would I have done differently? In hindsight, I would have stayed in America for longer, and I would have tried to do more hours at Solana Ortho, just because of what happened when I came back home. The lockdown sort of hit and I was kind of handcuffed on what I could do. And then I would personally want to thank Professor Brian Minnick. He did a lot for me in my last year. We definitely came very close and sort of helping and sort of learning what I could do in the future. He stuck his neck out for me to be able to get the placement at Solana Ortho, and he sort of helped me develop my character a little bit as well. Obviously I want to thank the staff at Solana Ortho. They were wonderful, they're amazing people, and I'd recommend it to anybody. If they can, try and get in and intern there. They're a great staff, it's a great clinic. They want to help you, they want to help as many people as they can come in and join the profession. And then obviously lastly, the Kansas Wesleyan office staff. If it wasn't for them, like, I wouldn't have been able to do it. You know, so they have to like agree and sign off and everything before everything happens. So that's it. Thank you for coming to my presentation. Hope you have a good day.